Time now for the live coronavirus update for San Antonio and Bexar County.
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson WOLFF, and tonight we're joined by Dr. Junda Wu, who is our medical director here in San Antonio, along with our Bexar County Public Health Authority. As you can see, I'm continuing to serve out the duration of my quarantine under the guidance of public health officials, so thank you very much for tuning in to our COVID-19 briefing this evening, which is virtual once again. Tonight, we are reporting 291 new cases of COVID-19, which brings the cumulative total to 70,528 since this pandemic began in San Antonio. Our new 7-day moving average is now 291. Unfortunately, we do have 3 new deaths to report tonight. 2 Hispanic males in their 60s and 1 Hispanic female in her 70s. Please keep them and their families in your prayers this evening. When we've reported deaths over the past 9 months, we have often heard the phrase used, underlying health conditions. I want to take a moment tonight to better explain what that means. Adults of any age with certain underlying medical conditions are at an increased risk for severe illness from the virus that causes COVID-19, including hospitalization, admission to the intensive care unit, and the need for ventilation and even death. According to the CDC, those conditions include cancer, chronic kidney disease, COPD, which is also chronic obstructive pulmonary disease, heart conditions, immunocompromised state, or also known as a weakened immune system from an organ transplant, obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes. In addition to these medical conditions, the data shows that other conditions such as asthma, high blood pressure, and dementia may also increase the risks of COVID-19. It's especially important for people to know that increased risk of severe illness does occur with COVID-19, and those who live with them to protect themselves from getting COVID-19 should take extra precautions. The hospital system tonight is now continuing to show more stress. There are now 422 COVID-19 patients in the hospital this evening, and of these patients, 67 are from El Paso. There are 62 new admissions in the last 24 hours, and we have 149 patients in the ICU this evening, along with 65 patients on ventilators. We're continuing to watch those hospital numbers very carefully. Very quickly now, before I turn it over to the judge, on schools, the school risk indicator bar is in the yellow zone, moderate. That means that the in-person instruction, if offered, should prioritize special needs students, at-risk students, and students who lack internet access. Students and staff should continue to wear masks and practice physical distancing when in person. Let me turn it over now to Bexar County Judge Nelson WOLFF.
Yeah, thanks, Mayor. And as we all know, while we may not be getting a spike, we are constantly going up, and there doesn't seem to be any stopping of it right now. Our hospitalization rate now is almost 11%, 10.8%. As you know, about a month ago, maybe a month and a half ago, the governor allowed county judges to open bars that do not serve food, which was a smaller percentage. There was already 2,000 open that do serve food along with restaurants. The CRC recommended that we do that. I think we were at about 5% then. We have continued to go up. So I asked them what would be their recommendation now as we move forward. Their recommendation on the bars that are not serving food, that if we have a positive rate of 10% or more for the next 2 weeks in a row, that we should close their bars. I'm following their recommendation because the hospitalization is getting close. The governor only allowed those bars to be open if it was less than 15%. So we're getting very, very close to that.
Great. Thank you, Judge. And as you know, many of our community is struggling through this pandemic, and we want you to know if there is assistance that you need with regard to paying rent or mortgage. We have an emergency housing assistance program for you. You can find more information on that by calling 311 or going to the website covid19.sanantonio.gov. Also, if you have lost a job and no longer have an income because of COVID-19, we have a training program available for you to train for skills for jobs that are available right now. And while you're enrolled in the training, you will receive a stipend to pay for rent, mortgage, utilities, groceries, and anything else that you require. Excuse me. So please get more information about that program by calling 311, or you can enroll by going to 210-224-HELP. And as always, you can get the latest on COVID-19 by calling, by texting COSAGOV to 55000, or by going to the website, excuse me, COVID-19, excuse me, .sanantonio.gov. Apologize, I've tested negative. That's just a little frog in my throat, but thank you very much. And we will now go to questions for the judge, myself, and Dr. Wu.
We have several questions tonight about bars. We'll start with a couple from News 4. Judge Wolf, when is the earliest bars could close down, and how many bars could potentially be impacted by opting out?
Well, my office has only had 25 bars said that they would open under that limited authority. And so there could have been more, I don't know, but I only had 25 let us know that. Again, it's 2 more weeks. So what does that mean? We all need to work a lot harder to get this positivity rate down, to help on our hospital situation before we really get into serious trouble again. So we have 2 weeks. Hopefully we'll all work together, get these numbers down. But if they keep rising the way they are, they'll automatically have to close, regardless of what I say, if we hit 15% on hospitals.
Do you feel the rising caseload as a result of bars being open?
You know, we don't really know completely where the rise comes from. We know there are a number of factors. We know that young people do go to bars, and it's a little bit more dangerous. We do know that. We do know that when you're drinking, your noodle's not working so good. But we also know there's a lot of other reasons why, with people just not being careful anymore, with larger people coming together. More and more people are coming down on the Riverwalk during the weekends. So you can pick it up anywhere, but we don't know for sure where it's coming from. We do know people bring it at home, and we do know it spreads at home once they bring it there. So we had Halloween, we've got Thanksgiving coming, we've got Christmas coming.
This briefing is continuing right now at KENS5.com and our Facebook page. 291 new cases to report tonight. That brings us to a total of 70,528. Sadly, 3 new deaths to report. That brings us to a total of 1,304. And we're hearing from the judge tonight about a decision that he's weighing of closing bars back down here in Bexar County. What might make that decision and when that might come down? We're going to have a full breakdown of that for you tonight at 10, as well as KENS5.com. We'll be right back after this break.